Ajay, for having me here. So from morning we have been hearing about fatty liver, how it is caused and what are its manifestations, how we'll diagnose. But can I have my slides here? Yeah. Yeah. So I would not use the podium here and I would try to be a bit interactive here. So we heard most of the time that whether it is fatty liver, whether you have comorbidities like cardiovascular disease, lifestyle interventions are most important. So let us go through. I bring you greetings from Gangaram Hospital, New Delhi. So I'll begin with a case. So this was a 47-year-old gentleman who was from a Punjabi family of Delhi, and he was a shop owner, accessory shop owner. And then he had a sedentary lifestyle. He did not have any time for exercise. He used to sit in his shop from 9 a.m. to 9 p.m. and there was no time for exercise, and he consumed mainly vegetarian diet, and he was a non-alcoholic. So he presents with chief complaints of fatigue for last 3 months and pain mainly in the right upper quadrant for last 1 month. And he was hypertensive for 1 year and he was taking antihypertensive medicines. And when we examined, there was some hepatomegaly. And when we did his anthropometric measurements, we found that his BMI was very high, about 30, which comes in the class 2 obesity. Weight was 90, height 5'8". And we did his basic investigations, which revealed mildly raised AST, ALT. Platelet was okay. Uric acid was slightly high. His viral markers were negative. HbA1c was in the pre-diabetes range, 6.2. Ultrasound showed grade 2 fatty liver, and we did his fibroscan, which showed an LSM value, which we were talking about, was 8.8, and CAP value, which tells us how much fat the liver has, was also high, 358. So we made a diagnosis is probably having NASH with liver fibrosis because LSM is high. So we'll say liver fibrosis, hypertension, prediabetes, obesity, and hyperuricemia. So what prescription will you give? Obviously, you'll write all the medicines and all, but before writing all the drugs, the first thing which should come to our mind is the weight reduction. That is the most important thing which we should start with. And weight reduction by lifestyle modifications, exercise, dietary counseling, that is most important. And then comes the role of drugs. Obviously, you will give antihypertensive and drugs for NASH he might require, which you'll hear from Dr. Ajay. So coming to weight reduction. So when we talk about weight reduction, first we should understand what is obesity. There are many definitions of obesity. So this is the WHO definitions of obesity, and it is based on BMI. So according to WHO definition, if the BMI is between 25 to 30, the person is overweight. If it is above 30, it is obese. Above 35, it is severe obesity, then morbid obesity above 40, and super obesity above 50. However, when these definitions were applied to Indian patients, way back in 2007, 2009, there were lots of studies which were done by Dr. Anup Mishra and his group, and they found that these cutoffs are way too much higher. For India, we need a lower cutoff. So this was a consensus statement by Dr. Anup Mishra, which was published in JAPI in 2009, and they brought down the definition of obesity to lower BMI cutoffs. And the normal BMI for Indian persons is 18 to 23. So up to 23 is normal, and above 23 to 25 is overweight, and above 25 is obese. So these cutoffs are different for India. And so based on these newer cutoffs, which we are now following since 2009, so what is the prevalence of obesity? So many studies have been done, and the prevalence of obesity in India is around 40%. That is a huge prevalence of obesity. So what should be the goal of obesity treatment? So if someone is 100 kg, would you like to bring his weight down to 60 kg? Is that possible also? So what should be the goal of obesity treatment? So in our hepatology community, and we keep on showing this slide, that even if you are able to lose 3% or 5% weight, there would be reduction in inflammatory component of the NASH. But if you are able to reduce your weight by 10%, even fibrosis would come down. But this is only one aspect. Since all of you are physicians, in almost all the cardiovascular or any comorbidities, if weight is reduced by 10%, 5 to 10%, many of these comorbidities will come down, like hypertension, dyslipidemia, type 2 diabetes. So the target weight loss should be just at least 10%. We cannot say that you have to reduce 25%, we cannot say you have to reduce 30%, but this is much more achievable for the patient. That if we advise him that if you are 100 kg, if you try to reduce it, bring down to 90 kg, then also you will have good outcome in all of these parameters, not just liver, fatty liver, not just fibrosis, but all of these cardiovascular events. Your MACE events will come down. So you should, and this is a much easily achievable target rather than asking him to reduce by 25% to 30%. So how do you treat obesity? So treatment of obesity, as I told you, depends on, first thing is lifestyle measures. You will increase the physical activity, you will give dietary, nutritional counseling, and if all these measures fail, then you will come to weight loss drugs, which now you are aware that many new drugs are coming out, like GLP-1 agonist, then there are endoscopic therapy and surgery. But I'll not cover all this part, I'll cover mainly the lifestyle measures. So one of the important lifestyle measures is increased physical activity. So I would give a basic knowledge of about exercise. So there are 4 types of exercise which we generally know. One is aerobic or cardio exercises. The other is the muscle training or strength training. Third is the balance exercise, and fourth is the flexibility exercise. One of the example of flexibility exercise is the yoga, which most of us are very familiar with. So how much exercise is recommended per week for a lean, healthy individuals to remain healthy? So this is the recommendation from American Cardiological Association and many societies, that for a lean, healthy person, to remain healthy, you have to do at least 150 minutes of moderate intensity exercise, or if some person is doing vigorous exercise, even 75 minutes per week is adequate. And then you have to add at least 2 days a week of strength training and also flexibility exercise. So at least 150 minutes of moderate intensity exercise per week. It is not too much. Just 30 minutes of exercise every day would be enough. So what are the benefits of exercise? So why is exercise beneficial? Of course, there'll be weight control would be there, but apart from weight control, there are weight independent effects of exercise. So what are they? So all of the studies, many of the meta-analyses have shown that because exercise can lead to weight loss, and so one of the benefits is obviously weight control. But so how much of the exercise is needed for control of weight? So if you're not adding dietary prescription, if you're advising only exercise to a person, if he's doing less than 150 minutes per week, there'll be no weight loss. But for weight loss, you have to increase the duration of exercise up to 150 to 225 minutes per week, then he'll achieve a weight loss of 2 to 3 kgs. And if he's able to do about 225 to 420 minutes of exercise, then he'll be able to achieve a weight loss of 5 to 7 kgs. So exercise alone would not be enough. So we'll have to add diet to it. But I told you there are other weight independent effects of exercise. So one of them are that exercise has got cardiovascular benefits, and it has been seen in many of the studies that those people who are doing lots of exercise, for example, they are doing vigorous exercise, they are most fit, they'll have least risk of deaths due to cardiovascular diseases. And those who are sedentary, they are not doing any exercise, they are least fit, they are highest risk of cardiovascular disease. So exercise has independent of weight reduction, the exercise has got benefit in cardiovascular diseases, and also exercises leads to decrease in visceral fat. It's the visceral fat, the fat which is in our tummies and which is in the waist circumference which is high. The exercise reduces that, and that is also beneficial. And also exercise improves our insulin sensitivity. We have been hearing that exercise, I mean, these patients of fatty liver disease or all of these diabetes and all these patients have high insulin resistance. So if we ask them to exercise, they have increased sensitivity to insulin. And then exercise also leads to browning of fat. We know that the brown fat is much better than the white fat. So when a person does exercise, then this leads to release of certain chemokines, which leads to browning of fat, which is a good fat. Then also exercise leads to release of certain myokines and hepatokines, which is again is beneficial not just for liver disease, for also for heart, for dyslipidemia and many other factors. And obviously exercise leads to improvement in our fatty liver disease. So what type of exercise? I told you there are 4 types of exercise. The 2 predominant types of exercise is aerobic exercise and resistance exercise. So which exercise should be recommended? And both, the studies have shown that either you do aerobic exercise or resistance exercise, both would be beneficial. But since most of these patients are also having comorbid cardiovascular diseases, so it's so for having much more benefit, like liver benefits plus cardiovascular benefits, it's best to do both these exercises. But if for certain reasons, like the person is too much obese, he can't move his joints, so if he's not able to do aerobic exercise, even resistance exercise can be advised, and that would at least lead to liver benefits, also some amount of cardiovascular benefits. And what is non-exercise activity thermogenesis? All people cannot do exercise and they don't have time, but if we just advise them to do simple lifestyle changes in their day-to-day activities, that can also lead to so much of benefits, like walking, taking stairs instead of lift, and moving, standing much more. All these are non-exercise ways to burn your calories, and they can also lead to so much of cardiovascular benefits. So it has been shown that people whose activities include lots of physical activities, like the daily laborers or those who do agriculture, they are burning so much of their calories by just by non-exercise activity thermogenesis. So they are not exercising in the gym, they are not doing daily walks, but because of their day-to-day activities, they are burning a lot of calories. So even by doing making changes to their lifestyle, they can burn a lot of calories. So take-home points regarding physical activities: exercise alone cannot lead to significant weight loss. It can lead to only weight loss of modest 3 to 5 kg in 1 year if the person does about 30 to 45 minutes per day. So we have to add diet to it. But exercise has other benefits: cardiovascular benefits, reduces visceral fat, improves fatty liver, and reduces insulin resistance and sugar control. And increasing physical activity can generally help in weight reduction. Coming to the role of diet. So whenever we are advising any diet to any patient, first thing we should do is ask him what is he consuming, how much is he consuming. So dietary counseling or nutritional counseling is the most important thing. So once a patient comes to him, you ask him what is he eating from morning to night. Either you can do it yourself if you have time, or your dietitian can do. And then from morning to evening, ask him what food is he consuming, and then you calculate what is the total calories. So this was the patient I mentioned. He came to us in the OPD, and when we calculated his total caloric intake, we found that he was consuming 2,800 calories per day, which was too much. So for a sedentary individual, 2,800 calories is way too much. And most of the guidelines, be it Western or Indian guidelines, they all mention that for a sedentary individual, he doesn't require more than 2,200 calories. So he was consuming at least 600 to 700 calories extra every day. So obviously he would gain weight, and obviously he'll have all these problems. And most of the guidelines now recommend that to reduce weight, you have to reduce their caloric intake. So if he's consuming 2,800 calories, you have to reduce his caloric intake by at least 500 to 1,000 calories per day. So only then you can achieve weight loss. And so our dietary prescription, his original diet was about 2,800 calories. We have to advise him that a low calorie diet that is approximately 2,000 calories. Apart from calorie restriction, what else? How can we change the composition of diet? Should we advise him low fat diet with the carbohydrates of 70%? Should we advise him carbs of 50 to 60%, or low carb diet, or what about ketogenic diet? Which works best? So let us first do a calorie breakup of this patient who had come to me. When we calculated how much protein, how much carbs, how much fat he was consuming, we found that he was consuming a lot more of carbohydrate that is required. The recommendation is from most of the societies that carbohydrate should be approximately 50%. He was consuming around 60%. Protein should be approximately 20%. He was consuming way less, and fat was okay. So what he should have consumed was protein, but he was replacing with carbohydrate. So the types of diet which cause obesity, is it high fat diet? High fat diet cause obesity because the fat itself is high calorie density, leads to overconsumption of energy and leads to obesity. And what about high carbohydrate diets? Carbohydrates cause insulin resistance, and insulin model of obesity is there. So high glycemic carbohydrates results in elevated postprandial insulin in these patients, and that causes increased hunger and increased consumption of this. So both of them are important, but recently studies have shown that it is the high carbohydrate diet which is much more responsible for most of these metabolic diseases such as cardiovascular diseases as well as fatty liver diseases. So there is a shift towards low fat diet to low carbohydrate diet in our recommendation for prevention and treatment of all the metabolic diseases. So either you advise him low carbohydrate diet or at least a balanced diet where the carbohydrate should not exceed more than 50%. So now coming to type of carbohydrate, there are three types of carbohydrate. One is sugars or simple sugars like glucose, sucrose. Then there's starch, which is complex sugar. And then fibers are also types of carbohydrate which are present in vegetables and whole grains, but these are non-absorbable carbohydrates. So what about sugars? How much sugar should he consume? Any person should consume. So sugars, for example, this simple sugar contains of glucose as well as fructose. Glucose leads to insulin resistance, as we know, and fructose leads to de novo lipogenesis. So if you consumes too much of fructose from these fruit juices or cold drinks, the fructose itself leads to increase of triglycerides in the fat. So both of them are bad. So now latest recommendations are that you have to limit the simple sugar consumption, and most of the guidelines now suggest that for men the sugar intake should not be more than 9 teaspoonful, and for women should not be more than 6 teaspoonful. But these are for normal individuals. If the person is diabetic, if the person already has metabolic syndrome, fatty liver, obesity, then it's better to avoid these simple sugars totally. That would be much better than advise him to take complex carbohydrate. What about glycemic index? many of the foods which contain lot of simple sugar are high glycemic index food, and when the person consumes high glycemic index food, there's increased insulin secretion, and then suddenly that insulin goes down, then there is increased hunger pangs, and the person eats much more. But if the person consumes low glycemic index food, then the energy release will be slow, and the person will be feeling fuller, and he'll obviously eat less. So the person should consume low glycemic index food. So instead of eating maida or normal atta, it's better to advise him whole wheat flour or multi-grain flour, which are much more having complex carbohydrate or low glycemic index. Similarly, it is better to avoid white rice and consume more of the brown rice or the red rice. What about fat? How much fat needs to be consumed? So whenever we go to a shop to buy any of the oils for cooking oil, we should look at the labels. We should read the labels. How much is the saturated fat? How much is the trans fat? And is there any monounsaturated MUFAs or PUFAs in that oil? How much is the omega-3 to omega-6 ratio? What is the cholesterol content? What is the smoking point of oil? Smoking point is once we heat the oil, it becomes denatured. It becomes, there are different oils for different cooking needs. And should we buy refined oil versus cold pressed oil? So just to summarize, the saturated fat should be less than 10% for to avoid any of these cardiovascular diseases. Trans fat, it is preferably, it should be 0. And it is better to have more of monounsaturated and polyunsaturated fatty acids, and more of omega-3, which is there in fish and flax seeds, and that should be consumed. Cholesterol content should also be preferably be 0. Smoking point we have to check, and depending our cooking needs, we have to check which oil we have to buy. For example, the extra virgin olive oil is not good for cooking. There are different varieties of olive oil that can be used. Then it is better to avoid refined oil, and cold pressed oil are much better. So extra light oil, extra virgin oil, these are good oils, but since these are expensive, you can consume any of these oils which have got mixture of 2 or 3 types of oil, which have got much better benefit. And we have to avoid saturated fat, we have to avoid trans fat, and unsaturated fats, polyunsaturated and monounsaturated, these are much better. What about protein? Although there's data is limited for protein intake in patients with fatty liver disease, but it is said that high protein diet causes weight loss because they increase the satiety, they improve the glucose homeostasis, they increase meal-induced thermogenesis. So if you consume more protein, you are actually burning more of calories. And so the recommended protein intake is approximately 20% of calories, or for a healthy individual, if he's not having any renal disease, 1 to 1.5 kg of protein can be consumed. And the good source of protein are soya protein, and also fish, poultry, and low-fat diets are a good source of protein. So the dietary recommendations for obesity, we have to advise low-calorie diet. That means you have to reduce their calorie intake. If he's consuming 3,000 calories, ask him to consume at least 1,000 less, so you can advise him to consume 2,000 calories. And you have to advise him that he should consume the carbohydrate should be not more than 50% from the diet, fat not more than 30%, and protein should be at least 20%. And we have to check the labels and avoid fructose containing drinks, substitute saturated fats with PUFAs and MUFAs, and prefer oil with more health benefits, and increase soy content and increase fiber intake. And whatever dietary advice you give, it should not be for a limited period. The person should adhere to this dietary advice, and it should be for lifelong. So dietary prescription, as I already told you, for my patient, he was consuming 2,800 calories, so I had advised him to consume only 2,000 calories. And apart from that, his calorie breakup, the protein, 500 calories from protein, 500 calories from fat, and only 1,000 calories from protein. So for dietary prescription, I'll give only 2 take-home points. One is eat less, so you have to consume less calories, and eat less of carbohydrates and increase more of protein intake. So to summarize my talk here, weight reduction is the most important therapy for any of the metabolic diseases, not just for fatty liver disease, but for most of these metabolic diseases, including cardiovascular diseases, diabetes. Calorie restriction plus dietary modification plus exercise, all 3 are important. We cannot just advise only exercise, we have to advise all 3. And the most important measure is to adhere to these lifestyle measures. And exercise, if you just advise only exercise, it leads to moderate weight loss. But exercise has got many other health benefits, which I already showed. And whatever advice you give, you have to ensure that the patient adheres to it. Thank you.